My name is Heidi Pomfret. I'm a OBGYN physician here at Longmont Clinic. Today we're going to talk about different forms of contraception. The most permanent would be permanent sterilization, and there's really two ways to do that. One is tubal ligation, which people can do just after birth. That can also be done not in the postpartum setting, but at any time with a laparoscopic surgery, where we put a camera in through the belly button, we visualize the tubes, and put a clip on each tube. A newer method that also uses occlusion or sort of interruption of the tubes is called the Escher procedure. And we put coils in the tubes. The coils allow the tube tissue to scar down, so that effectively blocks the tubes. So coming down from permanent to semi-permanent, one is the intrauterine device, and there are three of those. One is a copper device that has no hormones. It's called the Paragard. It's 10 years of contraception. The literature shows it's as effective as a tubal ligation. The second IUD that's available is a 5-year option. It's called the Mirena IUD. It has a little bit of progesterone that is emitted just inside the uterus. It tends to lighten the period substantially, and in about 20% of women, they don't get their cycle. It has sort of a little sister for women who have not had children called the Skyla. That one lasts 3 years. Those three are intrauterine devices. The second form is a bar we can put in the arm called the Nexplanon device that emits progesterone over a 3-year time period. That's also an in-office procedure. We put a little bit of anesthesia in the arm and then slip it under the skin, and it stays there for 3 years. All of those are, the literature shows, are as effective as a tubal ligation, but they have the advantage of being reversible. There's two other main forms of birth control. One is the Nuva ring, which is inserted into the vagina. We put it in on day 1 of the cycle, take it out 25 days later, allow for a cycle, and then put in the next device. The other is classic oral contraceptive pill. That can be taken in a traditional way where you have 28 days of the pill, or you can take the pill continuously. The advantage is the user has complete control in that the gynecologist is not inserting or taking anything out of the body. Compared to a generation ago, there are many, many effective and safer methods of birth control. With all that's available, I would encourage anyone who's interested in contraception to talk to myself or one of our other providers about what the appropriate method is for them.